Hello. Hello, everyone. Our topic today is we're going to learn about one of the world's most advanced AI clinical systems. I'm Bruce Rosen from Israel Healthcare Highlights, and my special guest today is Professor Ran Balicer. Ran is the Chief Innovation Officer and Deputy Director General at Clalit Health Services. He's also the founding director of Clalit Research Institute. Ran, welcome.
Thank you so much, Balch. It's great to be here.
Great. Please tell us about Clarit's advanced AI clinical systems.
That's a big one. Sure. So Clalit is actually quite a unique organization. It cares for over half of the Israeli population, usually from cradle to old age. And Clalit has been here for over 100 years, trying to care for half of the Israelis in that way. Now, the integrated way Clalit looks at the population level means that the embedded interest, both financial and clinical, of the organization is to provide integrated care throughout the continuum of primary, specialty, and hospital care with an aim to prevent future illness and not just to provide heads in beds or to have clinical meetings one needs to account for. In order to drive this type of innovation, Clalit has been creating for 15 years now advanced systems that have begun with predictive proactive care that are now being embedded in basically in the screens of every single physician and nurse at the community setting. We're talking about thousands of care providers. And the way this works is that the current systems right now are able, when a physician walks into the clinic on a Sunday morning and begins his work week, he sees on the screen who are the people who will benefit the most from coming in this week to the clinic proactively, not because they have pain or discomfort or any specific damages, but because of the future diseases, the future complications, the future problems that they will most likely be exposed to unless they come in. So they bring them in proactively. Then the AI systems that is currently employed in every single, it's the only place in Israel, and as far as I know, in most parts of the world that this is existing, that once the patient comes in, the system provides a list of suggested interventions, which are made through the combination of everything with the electronic medical record the patient has, all of the predictive modeling that is done behind the scenes, and the clinical guidelines and best practices. So the combination thereof creates all of the care gaps that are then being kind of ranked according to their importance and proposed to the physician for implementation as an explainable AI that with a click goes into the electronic health record. So this is just one example of AI in practice, and we can give other examples of finding fractures in the emergency rooms, et cetera. But I think this brings in a good understanding what we're doing.
That's great. That's great. So I understand Clalit both has community services and a large network of hospitals and has responsibility for all the care given to a patient. Can you give an example of how the type of condition where with the AI, the link between the community and the hospital comes together in an effective way?
So there are many such examples one can take into account. For instance, it could be the case that the patient has undergone a CT scan in one of the hospitals because of an abdominal pain, okay? And now this scan is entered into the system. The patient is discharged from the hospital. That same scan is being assessed through AI continuously behind the scenes. And if one sees in the vertebra of that patient signs of osteoporosis or sign of impending types of fracture that are associated with osteoporosis, then a recommendation for change of treatment appears automatically on the screen of the family physician. So all of this happens, hands off. And this is
Wow.
not a theoretical construct of something that is shown in the lab. This is embedded in this AI system of the primary care that I've talked about, a system that is called, by the way, CPI, or Clalit Predictive Proactive Interventions, which was created totally within Clalit as a combination of the IT division, the innovation division, and the medical and the community division.
Now, I understand that in addition to the world-class care that you're giving, you're also doing world-class research. Can you tell us a little bit about how those support one another and maybe also how this very special relationship you have with Harvard Medical fits in with this story?
Sure. So, the whole nucleus of Clalit Innovation, which is today a full division of Clalit, very well funded and a key part of the strategy, actually began quite a while ago, over 15 years ago, as the Clalit Research Institute, which basically we have been fortunate enough to be having access to some of the best data out there in the world because Clalit went digital mid-90s. And when we began doing this in 2007 or so, we already had a good repository of at least 10 years of accumulated data on our patients, which is fully integrated. And that notion then said, is it possible to use such data in order to do things like predicting future illnesses? It started as research. So within the Clalit Research Institute at that time, I founded it in 2009. And the concept was, for instance, let's begin by predicting future illnesses. The first one was to predict future deterioration of kidney functions and identify patients that will go slowly into end-stage renal disease. And we identified those patients in research that we've done at the Clalit Research Institute. And once we had the model created in the research side, we moved on to the practice side and asked our friends at the community health division, can we implement this? And we started implementing this by sending emails to physicians with lists of patients for interventions and having one of the senior nephrologists in the country walk clinic by clinic and try to persuade the physicians to change their practice. So this was the nucleus. So we all started with research. And then over the years, the understanding of, first of all, the sheer size of the number of such predictive models we put into practice, and then the addition of deep learning, like things that in which we used for imaging assessment and imaging interpretation, et cetera, that brought in new insights, and more recently, generative AI, all of this together has made us understand we need to scale it up from a research division to the innovation division that is now responsible for all of the above and more.
Amazing, amazing. I know you've
Oh,
gotten
and
this.
I owe you, wait, I owe you the answer about Harvard. So I will mention that we have begun our workings with Harvard about a decade ago when some of the ideas that we've made, actually we won the Harvard and the New England Journal of Medicine challenge on data, using data for medical practices, what was called the Sprint Challenge. And we had a lot of communication with Harvard afterwards, and we began doing projects together. And at some point, an amazing Jewish family called Ivan and Francesca Berkowitz and their entire family has been kind enough to support a new lab that was formed between Clalit Research Institute and the Harvard Department of Biomedical Informatics. So Professor Zach Ohani from Harvard and myself were the chairs of this joint lab. And in this lab, we have already, during COVID, created some of the most key studies to assess vaccine and other adverse events and effectiveness and some drug effectiveness. And from then we went on and on to create new types of AI in practice, looking at omics assessment as part of daily practice. And nowadays, a lot of foundation model work and generative AI in medical practice.
That's amazing. I know you guys have gotten a tremendous number of articles in the New England Journal of Medicine and other prestigious journals, as well as all sorts of awards. Let's say, and this will be my last question essentially. Let's say some group, some large healthcare organization in San Francisco or London or even the United Arab Emirates wants to learn about your approach and your model and maybe collaborate together, but maybe also just to learn and do it on their own. How would they communicate with you? How open are you to those sorts of additional collaborations?
We're really open to any and all of these collaboration. We're all the time looking for them. Let me give you an example. We started such a discussion with the organization in Germany called Charité, which is the largest basically health entity in the Berlin area. And I think in terms of the biggest, one of the biggest in Europe of its size. And we began by exchange of people on both sides that began talking to each other and promoting joint research. There's a double-digit number of research projects that came out of these meetings and that is ongoing. And now it went one step further, and we're trying to create a whole foundation of joint collaborative work between the organizations that is now taking shape. We also have done similar work at some point we have with Stanford in terms of health economics, and there are other examples. So the answer to how does one create a strong collaboration with us is really simple. Just drop us a note drop me a note or by LinkedIn or directly by email, and we will be more than happy to begin something that will be mutually beneficial in learning, because you always need to learn new ideas on both sides. We all the time are looking for new ideas in order to be able to do better what we're already doing.
Ron, this has been terrific. Thank you so much for joining us here today, and thank you for all the work you do over the years for the members of Clalit, for Israeli population in general, and for global health. Thank you so much.
Thank you, Baruch. Thank you, everyone.